Rub this oil on your skin every night. Here's what really happens to pain, inflammation, and aging. Stop rubbing arnica gel on your knees and hoping for the best. Stop trusting the label on that jar just because it says clinically proven. Today I want to show you what the actual randomized trials say about what you put on your skin, the treatments that work, the ones that are wildly overhyped, and the one sitting quietly in dermatology offices that outperforms almost everything else on this list for turning back the clock on aging skin. I'm Dr. Margaret Wilson. I've spent over 20 years treating patients with chronic pain, arthritis, and the skin changes that come with age. And I want to start with a number that surprised even me. In a 12-week trial published in the journal Drugs and Aging, researchers pooled data from 3 separate randomized, placebo-controlled studies, and found that a simple topical gel reduced knee osteoarthritis pain scores significantly in patients over 65 with treatment-related side effects occurring in under 8% of users. No stomach bleeding, no kidney strain, just a gel, rubbed into the skin. That's not a just my opinion quote, that's published data, and I'll walk you through exactly what that gel was later in this video, because it's not what most people expect. Before I go further, I read every single comment on these videos, and I mean that. So while you're watching, tell me 2 things down below: how old you are right now, and what's the one joint or the one part of your skin that's been bothering you the most lately. Is it your knees when you get up from a chair, your hands in the morning, or is it the way your skin has started looking thinner and more crepey on your arms? I genuinely read these, and it shapes what I cover in future videos. Now I want to be straight with you about something before we start the countdown. This is not going to be a video where I tell you one miracle oil fixes pain, inflammation, and aging skin all at once. That's not how the body works, and anyone telling you otherwise is selling you something. What I'm going to do instead is walk you through 5 real topical treatments, ranked from the one with the weakest evidence to the one with genuinely the strongest scientific backing, and be completely honest with you about which ones are overhyped and which ones deserve a permanent place in your nightstand drawer. Number 1 on this list is the one dermatologists themselves use, and it might not be the one you're expecting. All references I mention are linked in the description so you can read the original studies yourself. I'd rather you trust the data than trust me. Let's start at number 5. The one I get asked about constantly, and the one where I have to be the most honest with you: topical magnesium, often sold as magnesium oil or magnesium chloride spray. The marketing around this product is enormous. You'll see claims that it fixes muscle cramps, improves sleep, reduces inflammation, and replenishes magnesium levels your body is supposedly starving for. Here's the truth. Magnesium is absolutely essential. It's involved in over 300 enzyme reactions in your body, including the ones that let your muscles relax after they contract. That part is real biology. But whether rubbing magnesium chloride onto your skin actually gets meaningful amounts of magnesium into your bloodstream is still genuinely uncertain. Some small pilot studies, including one using hair analysis in just a handful of subjects, have shown increases in tissue magnesium levels after weeks of daily application. But these studies are tiny, often fewer than 30 people, and larger reviews have pointed out that your skin's outer layer, the stratum corneum, is built specifically to keep things out, not let them in. Health guidance bodies in the UK have looked at this evidence and as of now don't recommend topical magnesium as a proven treatment for cramps.
So why is it even on this list?
Because for some people, the physical act of massaging a cramping calf muscle with anything magnesium spray, lotion, even plain water, brings real relief. And that relief is not fake, just because it might be coming from the massage and not the magnesium itself. Think of it like a delivery truck that may or may not actually be delivering the package, but the driver still knocks on your door, and that human contact still matters to you. If you enjoy using it and it helps you relax before bed, there's little harm in it for most people. Just don't expect it to replace a magnesium-rich diet of leafy greens, nuts, and whole grains, and don't expect it to meaningfully treat inflammation, because right now, the rigorous evidence for that specific claim simply isn't there. I had a patient, I'll call her Dolores, 73, from a small town outside Sacramento, who came to me convinced her nightly magnesium spray was pulling toxins out of her legs. When we sat down and talked through what the studies actually show, she didn't stop using it, she just stopped expecting it to do more than it could. She kept it as part of her wind-down routine, alongside stretching, and honestly that combination helped her sleep better. Not because of detox, because of ritual and movement. Number 4 is one where the evidence gets a lot more solid. Capsaicin cream, the compound derived from chili peppers. If you've ever gotten pepper spray anywhere near your eyes, you understand instantly how this works. Capsaicin activates a receptor on your nerve endings called TRPV1, the same one that senses heat and burning. When you apply capsaicin cream repeatedly over days, it actually depletes a chemical called substance P from those nerve endings, substance P being the messenger your nerves use to transmit pain signals to your brain. Essentially, with consistent use, you're gradually turning down the volume on that particular pain channel. A meta-analysis of double-blind randomized trials involving nearly 500 osteoarthritis patients found that capsaicin produced a meaningful reduction in pain intensity compared to placebo. In one earlier trial, patients using capsaicin 4 times daily for 4 weeks saw osteoarthritis pain drop by roughly a third, and in patients with rheumatoid arthritis, pain dropped by more than half. Separate trials in painful diabetic neuropathy nerve pain that becomes more common after 65, especially in those with diabetes, showed capsaicin performed comparably to some prescription creams. Here's why this matters specifically for aging bodies. As we get older, our nerve fibers themselves change, and many older adults develop a degree of low-grade neuropathic pain, even without diabetes. Pain that doesn't respond well to the usual anti-inflammatory approach, because it's not purely about swelling, it's about oversensitive nerve signaling. Capsaicin targets that pathway specifically. The catch, and I want you to know this before you try it, is the initial burning sensation. That's expected. It typically fades with repeated use over the first week, and it's actually a sign the compound is doing exactly what it's supposed to do to those nerve endings. Apply it with gloves, avoid your eyes and any broken skin, and use it consistently. This is not a one-time relief product. It's a build-up over days product. For best results, pair it with a warm compress beforehand, which helps open up circulation to the area and can improve how the cream spreads and penetrates. I think of Harold, 68, a retired mechanic from outside Tulsa, whose hands had become so stiff and tender from osteoarthritis that he'd stopped doing the woodworking he loved. He was skeptical of the burning sensation at first, nearly gave up after day 2. But by the end of 2 weeks of consistent 4 times daily application, he told me he could grip a chisel again without wincing. That's not a miracle. That's substance P depletion, demonstrated in trial after trial. Before we get to the top 3, and trust me, they get more interesting from here, if this kind of honest evidence-based breakdown is useful to you, hit subscribe so you don't miss the next one. And give this video a like. It genuinely helps this information reach more people your age, instead of getting buried under the miracle cure videos that don't cite a single real study. Now let's talk about the treatment I mentioned at the very beginning. Number 3. Topical diclofenac, an anti-inflammatory gel that you may know by the brand name Voltaren. This is the gel behind that statistic I opened with. Diclofenac belongs to a class of drugs called NSAIDs, non-steroidal anti-inflammatory drugs, the same family as ibuprofen, but applied directly to the skin instead of swallowed as a pill. And this distinction matters enormously as we age. Here's why. Oral NSAIDs carry real risks for older adults: irritation of the stomach lining, increased blood pressure, strain on the kidneys, risks that climb the older you get, particularly past 65. Topical diclofenac largely sidesteps this. Because it's absorbed locally into the joint tissue rather than circulating through your entire bloodstream in high concentrations, you get targeted anti-inflammatory action with a fraction of the systemic exposure. In pooled data from 3 separate 12-week randomized trials comparing diclofenac gel to a plain vehicle gel in both younger and older adults with knee osteoarthritis, the diclofenac group showed significantly greater improvement in pain and physical function scores, and critically, the benefit held up just as well in patients over 65 as it did in younger patients, without a higher rate of the gastrointestinal or cardiovascular side effects that concern us most with oral NSAIDs. In another trial, patients using the gel saw their pain scores measured by the WOMAC index drop by over 50% from baseline, compared to about 43% with the inactive gel. Why does this matter for aging joints specifically? Cartilage breakdown in osteoarthritis isn't just mechanical wear, it involves ongoing low-grade inflammation at the joint itself. Inflammatory chemicals called cytokines that keep irritating the joint lining. Diclofenac gel gets directly to where that inflammation is happening, without having to pass through your entire digestive system and liver first the way a pill does. Applied properly, about 4 grams, roughly the size of a large grape, rubbed in 4 times daily to the affected joint, it becomes part of your daily rhythm rather than a rescue treatment. For timing, morning and evening application tends to work well for stiffness that's worst first thing when you wake up, which is extremely common in aging joints because overnight immobility allows inflammatory fluid to pool around the joint. A synergy tip here: Gentle range of motion movement like slowly bending and straightening the knee right after you apply the gel helps it work into the joint capsule more effectively than sitting still. Always check with your doctor first, particularly if you're on blood thinners or have kidney concerns, since even topical NSAIDs carry some absorption. Now we move into the 2 items on this list that address the aging part of tonight's title, not just pain and inflammation, and this is where the science gets genuinely exciting. Number 2. Over-the-counter retinol. If you've spent any time in the skincare aisle, you've seen this word on half the jars. Retinol is a form of vitamin A, and once absorbed into the skin, your cells convert it into retinoic acid, the active form that actually does the work. Here's the biology in plain terms. As we age, especially after 60, our skin cells slow down their turnover rate, collagen production drops, and the structural scaffolding underneath your skin, collagen and elastin fibers, breaks down faster than your body rebuilds it. That's what produces thinning, crepey skin, and deepening wrinkles. Retinol works by signaling skin cells to speed their turnover back up and by stimulating fibroblasts, the cells responsible for producing new collagen. In a double-blind vehicle-controlled study of middle-aged and older women, researchers found that topical retinol produced measurable improvement in photoaged facial skin compared to an inactive vehicle cream, including reductions in fine wrinkling. It's gentler than its prescription cousin, which we'll get to in a moment, which makes it a reasonable starting point, particularly for skin that's more sensitive or reactive, which becomes more common with age as the skin barrier itself thins. For best results, apply a pea-sized amount at night. Retinol degrades in sunlight, so nighttime use isn't just convention, it's chemistry to clean, completely dry skin. Since damp skin increases absorption and irritation, start 2 to 3 nights a week and build up gradually. The synergy tip that matters most here: always follow with a plain, fragrance-free moisturizer, and always use sunscreen the following morning without exception, because retinol makes your skin more sensitive to UV damage, and using it without daytime sun protection can undo the very collagen gains you're working for. I think of Ruth, 71, from a suburb outside Cincinnati, who'd been told by a well-meaning granddaughter that retinol was for young people. She started a gentle twice-weekly routine, paired with sunscreen every morning, something she admitted she'd never been consistent about before. 6 months in, what she noticed most wasn't dramatic wrinkle reversal, it was that her skin looked less papery, more resilient, and small cuts and scrapes healed faster than they had in years. That tracks with what the collagen rebuilding mechanism would predict. Which brings us to number 1, and I promised you this one would surprise you. Because unlike everything else on this list, this is the treatment that dermatologists themselves reach for first. The one considered the gold standard, decades of trials deep. Prescription-strength tretinoin. Tretinoin is the more potent direct form of retinoic acid. It skips the conversion step that over-the-counter retinol requires, which is exactly why it needs a prescription, and exactly why it works faster and more powerfully. A systematic review and meta-analysis pooling 8 randomized controlled trials, involving over 1,300 patients with a median age range stretching well into the 70s, found that compared to an inactive vehicle cream, topical tretinoin produced significant, measurable improvement in both fine and coarse facial wrinkles, with benefits documented in trials running anywhere from 16 weeks to 2 full years of continuous use. One landmark 2-year, placebo-controlled trial found that tretinoin cream produced sustained improvement in photo-damaged facial skin that continued to build the longer patients used it. This is not a treatment with a ceiling that hits at week 4 and stops. Here's why this matters so specifically for skin after 60 or 70. Chronic sun exposure over a lifetime does something dermatologists call photoaging, which is distinct from purely time-related aging. It involves disorganized collagen fibers, an irregular thickened outer skin layer, and mottled pigmentation, all of which respond specifically to retinoic acid's ability to normalize how skin cells behave and rebuild organized collagen structure underneath. In one trial, researchers even documented histological changes, actual measurable changes in the skin tissue itself under the microscope, showing new collagen formation in the deeper layers of skin after sustained tretinoin use. That's not surface-level moisturizing, that's structural rebuilding. The practical side matters enormously here, because tretinoin causes more irritation than over-the-counter retinol. Especially in the first few weeks, redness, peeling, and dryness are common and expected. This is precisely why you need a dermatologist involved, both to get the prescription and to guide your starting concentration, typically beginning around 0.025% for older or more sensitive skin. Apply a pea-sized amount at night to fully dry skin, Wait 20 minutes after washing your face before applying, and start just 2 nights a week for the first month. The single most important synergy tip on this entire list, pairing tretinoin with a plain, fragrance-free moisturizer containing niacinamide, has actually been shown in trials to reduce the irritation associated with tretinoin, while potentially improving the stratum corneum, the skin's outer protective barrier, meaning you get the collagen-building benefit with less of the discomfort. I think of Eleanor, 79, from a small coastal town in Oregon, who had spent decades in the sun without much sun protection, something she readily admits now. Under her dermatologist's guidance, she started tretinoin at the gentlest concentration, twice weekly, paired with a niacinamide moisturizer every single night regardless of whether it was a tretinoin night. A year later, the deep creases across her forehead had visibly softened, and more than that, she told me her skin simply felt sturdier, less like tissue paper, more like it used to feel decades earlier. That's collagen, rebuilding itself, exactly the way those 2-year trials predicted it would. So here is what I want you to walk away with tonight. Getting older does not mean resigning yourself to stiff joints, burning pain, and skin that no longer feels like your own. It means being smarter and more selective about what you put your faith in, choosing the treatments that have actually been tested in people your age, in real randomized trials, rather than the ones with the flashiest marketing. Independence, the ability to garden, to hold your grandchild without wincing, to feel comfortable in the skin you've lived in for 70 or 80 years, that's worth being a careful, informed consumer for. It is never too late to start using the evidence-backed approach instead of the trendy one. Your body responds to real biology at any age, and every single study I cited tonight included people well into their 70s. If this video helped you cut through the noise, subscribe so you don't miss the next one, and tell me in the comments which one of these 5 are you already using, and which one are you going to ask your doctor about this week. I read every comment, and I'll see you in the next video.